Patient advocacy is a relatively new thing to me. I had not been previously familiar with it. I think that it's obviously a filling a void and a need that exists out there today in terms of people who really don't know which direction to go in terms of healthcare. And I think that I had not previously been exposed to this. However, now looking at the program and having some exposure to it makes me appreciate the need that is there for patients to be able to sort through their options and get the healthcare that they need. And the fact that it is a complex, a difficult, multi-layered system, and it's hard to sort of navigate through all of that on your own by yourself. I think it's huge, and I think we need to multiply you by a factor of a couple thousand, because you need a bunch of advocates around, because a lot of people just don't know where to go and what to do, and they're really uncertain about where they're doing and what they're doing.
Okay.
So it's a real problem, and I think it's only, unfortunately, I think, going to get worse. We're insuring more people, we're offering more things to more people, but a lot of these people are uncertain about where to go and what to do, and in some cases, a lot of these people are pretty sick, and they've had issues for quite some time that have not been addressed. Mm-hmm. And this is the first time that they find themselves with the option to then do something with healthcare, but they don't know which way to go and what direction. Mm-hmm. to go in, and so it's really complicated, and I think it's getting worse. I've had patients who've been very, very frustrated and asked me, I'm a surgeon, so obviously I see patients regardless of whether they, in the hospital, out of the hospital, doesn't make any difference. A lot of medical doctors will not see patients in the hospital anymore. So if the patient does get admitted, then they get managed by a hospitalist. Right. And the hospitalist, again, it's continuity of care. Do they really know the patient? Do they really know what's going on? And are they able to then seamlessly, smoothly transfer their care from inpatient to outpatient? Mm-hmm. I think that's a huge problem, and it's going to get worse also.